everyone. I'm Dr. Angela Mattis, consultant ophthalmologist at AB Vision Eyecare, and welcome to Ask Me, our monthly session where I answer your pressing questions about eye care. Today's question says, Dr. Mattis, I'm a parent with children going back to school soon. I want to educate my children on eye safety as every school year they suffer from infections such as pink eyes. Please advise me on some tips to share with my children. Okay, well, this is a big topic, and you know the children are the future. So let's talk about their eyes. As children grow, their eyes change quickly, and vision problems are very common in school-going children. Now, signs that may indicate a child has a vision problem include complaints of discomfort and fatigue, frequent rubbing eyes or blinking, short attention span, avoiding reading and other close activities, covering one eye, tilting their head to one side, holding reading materials very close to the face, an eye turning in or out, seeing doubles, losing place when reading. That sometimes may be normal, but you have to watch out, and difficulty remembering what he or she has read. The most common eye problem in children is refractive errors. A refractive error is a condition in which objects are not focused clearly. And there are three main types of refractive errors. There is myopia or nearsightedness, hyperopia or farsightedness, and astigmatism. And I'm sure you have heard these terms. Now let us talk about them individually. Now, myopia or short-sightedness is when a child has difficulty seeing objects that are at a distance and they appear blurry. This is the most common vision problem in children. And in this situation, when they are sitting in the classroom and looking at the board, they are not seeing it clearly. About 9% of children aged 5 to 15 years are nearsighted. And studies now suggest that near work activities, including screen time, may be connected to both nearsightedness and digital eye strain. Now, please, I am not saying that using the computer will cause you to be nearsighted, but in individuals who are predisposed, because nearsightedness is an inherited disease condition, and so children who are already predisposed, if they do a lot of near work, it also encourages nearsightedness. So we advise children to follow the 20-20 rule. I've mentioned it before. When they are on the computer, look up from the screen every 20 minutes and focus at least 20 feet away for 20 seconds. And this applies to all of us. Now, nearsightedness is managed with corrective glasses. Now, hyperopia or long-sightedness. This is the opposite of myopia. If a child suffers from hyperopia, he or she can see objects at a distance with reasonable clarity, but he or she will struggle to see objects that are close by clearly. In most cases, it gets better with time as the child grows and the eye grows. However, correction with glasses may be needed in some cases. Now, our other condition is astigmatism. Now, astigmatism is a condition that is caused due to an improperly shaped cornea. Now, your cornea is that surface at the front of the eye where you place a contact lens. Under normal circumstances, the cornea is smooth and curved in all directions. But when the cornea isn't smooth and curved evenly, it causes a refractive error where the light rays aren't refracted properly. If a child suffers from astigmatism, objects appear blurred even if they are close by or at a distance. Astigmatism is often associated with myopia and hyperopia. And that too is corrected with glasses. Now, strabismus. This is another eye condition, and it is seen commonly in children. and strabismus is also called crossed eyes. Now, if a child suffers from strabismus, one or both eyes are misaligned. And it is common, as I said before, and one eye may be turned either in, so one eye may be turned in, it may be up, it may be out, it may be down, while the other aims straight ahead. And when one eye turns, two different pictures are sent to the brain. And in a young child, the brain learns only to see the image from the straight or better seeing eye. Losing depth perception happens as well in this condition. In most cases, eyes that are not aligned can be straightened, but this needs to be done early. So patients need to be seen early. So this can be best done early. It's not that it can't be done later, but it's best done in the early years. Now, another condition that is common in children is amblyopia. Amblyopia is another word for it is lazy eye. I'm sure you have heard of lazy eye. Now, it is an eye problem that occurs when one eye has worse vision than the other eye. And it is usually caused by developmental issues. And by developmental issues, I mean in utero, when the mother is pregnant. Now, because one eye is weaker than the other, the brain will favor the unaffected eye, and the weaker eye typically appears as crossed or turned. Amblyopia often occurs in children as their brain and eyes are forming vital connections, as I mentioned, in utero, and anything that interferes with this connection can cause a lazy eye. Now, things that may interfere with the connections include strabismus, and here we just spoke about strabismus or crossed eyes. So what I'm saying here is that a crossed eye can cause an eye to be lazy or to develop strabismus, or strabismus itself can cause a refractive error and cause visual impairment. So the two work together. Now, when we have other conditions that can cause a strabismus, this includes a cataract or a droopy eyelid or a refractive error. So these conditions cause the vision in the eye to be poor, and the brain ignores the image from that eye, and so the eye becomes crossed or turned in or turned out. Now, a lazy eye can be diagnosed by an ophthalmologist in an eye test and can be treated with patching or corrective glasses, eye drops, or eye training, certain eye exercises. The earlier a lazy eye is detected, the better the visual outcome, because we can actually patch the better seeing eye and let the lazy eye be used, so we get it to be used so that it can improve visual acuity. Now, another common condition that we see in children and adults as well, but certainly we're talking about children today, is pink eye or conjunctivitis. Now, the word pink comes about because the eye gets pink or red due to the inflammation of the conjunctiva, conjunctivitis. Now, that conjunctivitis or pink eye can be due to a viral, a bacterial infection, or allergies. When a viral infection is the cause, the child may also suffer from fever, runny nose, and other symptoms of the flu. This is the most common eye infection, and it is very contagious. So when you have these viruses going around, you can get pink eye, and it's very contagious. And some of the signs include redness, tearing, discharge, feeling of grittiness or sandiness or soreness in the eye. And you have all come across that. Bacterial conjunctivitis is also due to germs, different from the virus, of course, and you usually have periodic outbreaks. The difference between our bacterial conjunctivitis, for the most part, is that a bacterial conjunctivitis tends to be mostly one eye. Viral conjunctivitis, because it is associated with the flu, tends to be both eyes. But you can have a bacterial conjunctivitis affecting both eyes. Children with pink eye in general should stay away from school or daycare until the condition has completely resolved. Frequent hand washing certainly can limit the spread of eye infections to the other family members. And our bacterial conjunctivitis is treated with antibiotic eye drops or ointment. Another important topic which can be discussed on its own where children are concerned is trauma and eye trauma. Every single year, thousands of children sustain eye damage or even blindness from accidents at home, at school, or at play. More than 90% of all eye injuries can be prevented. Now, sports deserve a particular attention because eye injuries often occur in children and young adult athletes between the ages of 5 and 14 years. Many children suffer sports-related eye injuries each year, and this can be prevented primarily by the use of protective eyewear. Now, different activities have different levels of risk for eye injury. So make sure that the right kind of eye protection is being used for each type of sporting activity. Regular eyeglasses do not offer proper eye protection, and some can make things worse. So when children participate in sports, recreation, crafts, or home projects, it's important for them to know eye safety practices and use the appropriate protective eyewear. How can we prevent some of the injuries? As I said, 90% can be prevented. So the children should wear eyewear made of polycarbonate lenses. So children involved in basketball, football, soccer, hockey, cricket, those sports, yes, they can get eye injuries. All chemicals and sprays must be kept out of reach of small children. Parents and teachers and others who provide care and supervision for children need to practice safe use of common items that can cause serious eye injury. Paper clips, pencils, scissors, wire coat hangers, rubber bands. I have seen children come to my office who have been stuck with pencils. Remember, try to only purchase age-appropriate toys for your children and avoid projectile toys such as darts and bows and arrows and missile-firing toys. Now, when very small children are bitten by dogs, and yes, we see this often enough too often, the eye injury, it tends to, for some reason, the dogs affect the eyes and reach for the eyes in about 15% of cases. And so we see dogs scratching the eyes and cats scratching the eyes. On another level, fireworks. At that time of year, we see fireworks injuries. So do not allow children near fireworks. And because these fireworks pose a serious risk to causing bleeding in the eye and serious eye damage. So we say prevention is better than cure. And how can we, continue to prevent eye injuries? We want the children to get regular eye checkups. And so this can be done maybe annually or every other year. And it should be done by a reputable eye care specialist. And when this is done, we can avoid any potential problems. We can pick up problems early and treatment can be initiated before things get worse. Now, apart from regular checkups, here are some more steps you can take to prevent eye problems in children. A healthy diet. Remember, the eyes are a part of the body, and you want to remember that whatever you put into your body can affect the eyes. In the developmental years, children require adequate amounts of nutrition for healthy eyes and body. So make eye-healthy foods and general foods a regular part of a child's meal, and this can help to promote their eye health and encourage them to have a lifetime of healthy eating habits. Foods high in nutrients such as zinc, omega-3 fatty acids, vitamin C, vitamin E, such as green leafy vegetables, carrots, fish, citrus fruits, seafood, etc., are excellent additions in a eye-healthy diet. You notice I did not only say carrots. Remember, persons, carrots are beautiful and fine, but carrots don't reverse eye disease, and carrots are healthy, starchy veg, and so I encourage it, but there are lots of others that I mentioned earlier. Get adequate sleep. Adequate sleep rejuvenates the whole body, including the eyes, and this ensure that children get enough rest. A regular sleep routine to get adequate rest promotes children's eye health, and make sure that your child goes to bed at the same time every night and in a quiet room, and so they should limit the use of screens such as your computer, your tablets, your mobile phone, and so on before bedtime. And I can't stress enough, limit the screen time as well, because prolonged screen time can be very harmful to children's eyes. Children above the age of 2 should spend no more than 2 hours a day using a digital device, and infants should have no screen time at all. In cases where your children must learn online, please make sure that they take extra care of their eyes. The best replacement to screen time for the children is to go and play outside. Outdoor playtime benefits all aspects of a child's physical, mental, and eye health. So with those tips, I hope you remember some of what I've said. So thank you for watching. See you next month for our next insightful session. And remember, if you have a question, just drop them in the comment section below. Thank you.